Good morning, everybody. We've got a good number of attendees already on. We're going to start in just a couple of minutes because it is still a little shy of 11:30. It's always fun how the last 90 seconds, everybody starts clocking. All right, according to my phone, it's 11:30 now. I'm going to welcome everybody to MedCost's new question and answer panel. This is the second installment of our 7-part series this year. Today, we're talking about kidney health. For time's sake, instead of introductions, I've attached bios or little speaker intros in the handout section. So if you look at your GoToWebinar panel, a little bit of housekeeping, you'll have several little arrows off to the right. And if you go down to the bottom, there's a handout section that says 205, handouts 205. And that's where you'll find introductions to today's speakers. Also a copy of the questions if you want that as a reference for your notes later. Above the handout section is a question section. If you have additional questions and we have time, go ahead and post them there as we go. Or if you have follow-up questions to what we're talking about, I'll try to monitor as best I can to make sure that we get all of your questions answered. Of course, there's never a deadline on questions. You can message your contact at MedCost or me at any time, and we're happy to get back to you. With that said, again, for sake of time, let's go ahead and get into our first question. Why should kidney health matter to an employer? And for this, we're going to start with Donna Sankey. Donna, why should kidney health matter to an employer?
Well, the most obvious response, of course, is cost. The data that's out from 2018 shows that Medicare itself paid about $130 billion on treatment for various stages of renal failure. In the per member per year cost of those people who have a chronic kidney disease that doesn't even require dialysis is already double of what a standard Medicare patient is. So the cost is certainly increasing. But it's not just the cost, even though that is significant. There's the productivity of employees and sick time usage. People with chronic kidney failure, they feel it. As renal function decreases in a member, there's a buildup of toxins and impurities in the bloodstream, which can cause people to feel more tired. They have a lot less energy. They become physically weak, or they might even have trouble concentrating. So when you think about the job that they're doing, with almost any job, it's going to decrease your production or your output, and ultimately hurt the bottom line.
That's great. I remember maybe a year or so ago, I found a study from the American Diabetes Association, they estimated in 2017 the number was $327 billion attributed to the cost of diabetes specifically, you know, all the other concerns for kidney health, and allocated $90 billion of that to lost productivity. And that's powerful, you know, but I always like to think about it. So if you're losing $90 billion of productivity, what else is happening? Right? How is it affecting your life? I had a friend recently with a similar health situation, and the first thing on his mind was, who's going to get my daughter off the bus? You know, while I'm dealing with these things with my schedule.
Right. So can I just add to that, from what you said there, I will just add that statistics do show us that we've got 1 in 7 people who have some degree of kidney disease. And most of those people, even people will get into the later stages of kidney disease, don't even realize that they have kidney disease.
Oh, wow.
So it's very rampant, if you will, and hypertension and diabetes, of course, the obesity epidemic in America, all of those things contribute.
Absolutely. Well, we see it in health. Awesome. Any of the other panelists have something else to contribute to this question? All right. Let's move on to our next question. For those who've just joined us, if you have additional questions you'd like to run by our panelists, please post them in your little control section on GoToWebinar. There's a questions tab, and you can post questions there, and I'll try to keep an eye out for them. So for our next question, I'm going to direct these at Katie and Zafira, or this one at Katie and Zafira. What things can employer do to promote kidney health without a major financial investment? And we'll start with Katie and then go to Z.
Yeah, no, and I'm going to piggyback on something that Donna just ended with as well. 2 things come to mind. Number one is we know those who do have some type of underlying condition, maybe it's diabetes, obesity, hypertension, those things can put a strain on the kidneys itself. So before those conditions progress into something further, you know, employers really need to think about, what is my cost management strategy for those who might be in that rising risk? You know, let's manage what we have right now before it progresses. But then also looking at the prevention side of things and the lifestyle component. You know, we really have to look at, you know, tobacco, diet, exercise. Those things all really play a huge piece in leading to not only prevention, but really helping people manage conditions so they don't again progress. Curtis, I'm hearing an echo. Is everyone hearing an echo, or is that just me right now? I hate to pause in the middle.
Yeah, it's a little bit. If you keep talking, I'll look out for which of us it is.
Okay, thanks. So, you know, things as simple as a tobacco cessation strategy. You know, what are employers doing? You know, is there any type of tobacco surcharge in place? Is there even simply the promotion of resources that can help, you know, members, you know, quit tobacco? Diet, we definitely know that diet plays a big part in kidney health. You know, so what are the nutritional resources that are available? Not only looking at diet from a weight management perspective, but, you know, certain elements of a diet, such as sodium, are such an impactful thing upon high blood pressure and kidneys. And so, you know, looking at those nutritional resources and promoting them. You know, obviously exercise, we bring exercise or physical activity back to so many conversations as well. So just making sure that an employer not only is providing resources, but so often members just forget what they have access to. So making sure that they're being talked about and promoted and openly encouraged for everyone to take advantage of.
That's huge. We said it just the other day. We can reach out all we want to engage people for whatever programs make sense for the population, but if they don't engage us back, right, we can't be effective.
Right, exactly.
Curtis, do you mind if I just add an additional comment in on that before Zafira joins us in the conversation? I would just echo what Katie said in this particular space with the population about the nutrition and the diet. I think employers, when they think about those types of resources, one particular area that they can take a really keen step in looking at is the nutritional counseling benefits that they have available through their plan, through their health plan offering. Because honestly, a lot of the individuals that fall into this population category, it's not just as simple as being able to go to the grocery store and choose the right foods. They really have to have that formal education to understand what those appropriate choices are, and nutritional counseling benefits are a great way to take advantage of that resource. So
that's awesome, Jacqueline. That's great.
And I'm going to jump in there as well, Curtis. I feel like this is a good point to talk a little bit about medication adherence, meaning, you know, individuals just taking their medications as prescribed by their healthcare provider. And what we see in studies is they pretty consistently show that anywhere from about 20 to 30% of medication prescriptions are actually just never filled. So people never even go pick them up from the pharmacy. And this number really surprised me, but about 50% of medications for chronic diseases are not taken as prescribed. So those are some pretty significant numbers. And this leads to a lot of additional healthcare costs every year. In the United States, it's estimated to be nearly $100 billion every year just due to medication non-adherence.
Wow.
Of course, in addition to the dollars, this also negatively impacts, you know, individuals' health and their overall well-being. So I'd like to share an example with you really quickly that we encountered a few weeks ago. So we had an individual who was working with one of our MedCost nurses in our personal care management program. And this individual, he had diabetes, high blood pressure, cholesterol. So he was managing a few chronic conditions. And he told the nurse that over the last few weeks, he hadn't been taking his diabetes medications because he honestly just couldn't afford the copays right now. He was going through some tough times and he just couldn't afford it. So he started taking it every other day and then he ran out and he just never started taking it again. So due to that, of course, his blood pressures were all over the place. He wasn't really feeling well. He missed a few days of work, which further added to his stress. He told the nurse that a few evenings prior, he had considered going to the emergency room because he really just fell off. And that was just because he wasn't on his diabetes medications. And obviously, this is a problem, but we know that if he's consistently not taking his medication and his blood sugars are consistently uncontrolled, then that's going to eventually lead to a lot of kidney damage, which is what we're trying to avoid. So to make a long story short, we were able to work with the individual and their doctor to do two things. We switched one of his medications to something that was a little more affordable, so he was able to get that. And we also identified some manufacturer assistance to help cover the cost of the other drug. So now he's able to get his medications at the pharmacy. He's able to adhere to them. His blood sugars are back under control. He's back at work and he's feeling good. He's a lot less stressed now. So I tell you all that. Really, the moral of the story here is that proper medication adherence, while it may lead to increased pharmacy costs, right, because now the member's filling his medications, so the health plan will be feeling the cost of those medications he's feeling, but really in the long run, it's going to lead to overall better health for this member and lowered healthcare costs in the long run.
No question.
So,
avoid the high blood pressure implications, avoid, the diabetes or the insulin non-compliance or non-adherence. I mean, that's huge.
Yep, it is. And so in this space, what can an employer do? Just a few things is making sure your pharmacy plan offers adequate coverage for medications for key chronic conditions like diabetes and high blood pressure. taking a look at your copays and coinsurance to make sure that your employees do have some skin in the game, but you don't want the barriers to be so high that members can't get the medication they need. And we do find that sometimes some individuals need a little bit of additional support. Like in this case, he really needed that assistance from the nurse at MedCost, the case manager, to really help him through the situation. That's why medication adherence is really so important.
That's it. You talk about the balance of cost and disruption, right? And it's not so much about one or the other. It's really calibrating the disruption so it's in the right place and not the unintended consequence of creating a barrier to medication adherence.
Yep.
Well, so all these things, we're not talking about any additional programs except maybe nutrition counseling, which there could be programs in the community that are available. A lot of providers offer those things. So not a major investment, but things that employers can do to really focus on the person, rather than the things just that happen in the behavioral portion of the plan. Thanks, y'all. All right, our next question. So Jackie, I've saved this one for you. How is COVID-19 affecting kidney health?
Oh, that's a great question, Curtis. COVID-19, we're all still learning, of course, about the impacts of what that means for our population, of course, in the short term and the long term. There's really two different tracks as far as the kidney population goes in COVID-19. The first track that I would really emphasize are those with known chronic kidney disease, particularly those on end-stage renal disease receiving dialysis. We know with COVID-19 that those individuals are 11 times more likely to be hospitalized than people who don't have kidney disease if they contract COVID-19. So there are some very specific prevention measures that we would recommend, and I'll talk about those in a moment, that employers can really try to communicate to those individuals to try to prevent contracting COVID-19. I think the other track that I would mention that is less known are individuals that are otherwise healthy adults that they do contract COVID-19 and they develop what we call acute kidney injury, which is a sudden loss of kidney function as a result of COVID-19. So about 1 in every 3 people admitted to the hospital for COVID-19 will develop an acute kidney injury. So 33%, it's pretty staggering. And not many folks are aware of that at this point. But this sudden decline in kidney function, if it's not managed well, or if those individuals progress to becoming critically ill, requiring intensive care, things of that nature, they may require emergency dialysis. And then the hope there is that you give the kidneys a rest long enough for them to recover, as the individual's also recovering COVID-19. But there still may be longer term effects from that. Unfortunately, right now, we really don't know. We have researchers that are studying the impact related to COVID-19, both short-term and long-term. But the best things that we can all do to try to help control and prevent both COVID-19 impact on those with chronic kidney disease as well as with acute kidney injury are trying to prevent contraction of COVID-19. So following all of the very public prevention techniques such as physical distancing, practicing good hand hygiene with frequent hand washing. You want to make sure that these individuals, in particular those with chronic kidney disease and those that are on dialysis, that they try to stay home as much as possible. But if they do have to go out, they're doing those hand washing techniques. They're using hand sanitizer whenever they're touching any items that could be touched by other folks, like gas pump handles are a good example, credit card machines when you're making your purchases, even just door handles. Sometimes that's so easy to forget because we're going in and out of doors so frequently. That's a great time to use hand sanitizer as well. With these individuals, wearing a really high quality mask that has a tight fit to prevent those air particles from contracting COVID-19 is also another recommendation. And then for those individuals that are actually receiving dialysis services already, another great intervention that employers can help to recommend is really trying to stock up on home supplies, making sure that they have kidney-friendly foods, household supplies, so that they can try to mitigate how often they're having to leave the house. And then to Zafira's point, from a medication standpoint, making sure they at least have a 30-day supply of medications, but we would highly recommend a 90-day supply during these times. So again, that helps prevent them from having to leave the house as often as they would normally.
And typically a cost savings in the plan, right? Go to the 90-day supplies.
That's correct. Correct. And then the 90-day, of course, has some great home delivery options as well to reinforce not leaving the house.
That's wonderful. All helpful stuff. You know, Jackie, you know, I've talked quite a bit about the deferred care, right? The moratorium on elective procedures in second quarter last year, and still maybe some more socially influenced delays of care or deferral of care that based on people's own choices rather than requirements. Are there implications, or have you heard anything about the implications of that in this kidney health population?
Yes, no, that's a great question as well, Curtis. And yes, there are high implications, particularly with this segment of the population, if individuals are choosing not to go to their physician appointments or not to go to their dialysis services. That's only going to exacerbate their conditions and cause acute needs for emergency room visits or hospitalizations. And we understand the concern there and why they may be choosing to defer care. But what I would say that we've seen, not only from the interactions that our case managers have had with members in this particular population, but we're also seeing it in the data as well, is because the provider community has done such a fantastic job of really making telehealth services available. There really shouldn't be as much of a concern for individuals to not maintain their physician appointments. We understand dialysis, you do need to leave the home and you need to go to those facilities to have those treatments completed, and that needs to happen. But individuals that do have those concerns can mitigate at least the visits with their physicians and their providers by opting for virtual visits, because I've not heard of one provider that doesn't have those capabilities now that COVID has taken place.
In differentiating between the typical urgent care telehealth visits or the more primary care or specialty care virtual visits, it's a different experience that people can be looking for. I think some of us have seen both of those over the past 12 months.
That's right.
That's great. All right, I want to remind everybody in the audience, if you have questions or have follow-ups to the questions that we've already asked, please post them in the chat on your GoToWebinar control panel. And we're moving to our last question in our prepared list. And this is one of my favorite ones. We'll ask this in every episode. If an employer could do only one thing, but could do that thing really well for their population, what should that be? And I'll start with Donna, and then Katie, and then anybody else. So Donna, you're up.
So I want to just real quick say two things, if you don't mind. In this remote workforce that we find ourselves in, and certainly when we start to return to some degree of normal, whatever that's going to look like, I think first and foremost, I think that preventative screenings can be promoted. And we know that the best way to treat chronic kidney disease is just to get early detection. So to promote and support people in finding a primary care physician, getting those yearly physicals done with those normal lab works that come to check the renal functions, check your A1C, do those types of things that would clue somebody into some changes need to be made early on. And certainly that'll be helpful. I was looking at the rate of obesity in our country, and it was alarming that 18.5% of obesity in children between 2 and 19 years of age. It is already at 18.5%. So we know that that's going to lead to hypertension, diabetes, chronic kidney. So I think we have to ask ourselves, how can we honestly get involved in our communities to help educate our children to keep this snowball from growing? And my second response would be, as we return to a normal workforce, we really need to take an opportunity to look at the vending machines in the break room. I think that you can likely get rid of about 95% of the items in those machines and probably replace it with water and some snacks that are more like dried fruits or multi-seed crackers or some kind of tuna packs and protein shakes and that type of thing. And those little changes of things that you just grab when you have that gnawing hunger can make a huge difference to a population.
That's a great point, changing the environment they're in. Awesome. And I was going to ask the question, what can an employer do, Donna? So you nailed that.
And Donna, I'll piggyback. I was thinking the one thing, and I'll go back, and I said this earlier. Donna, you hit it beautifully though with the preventive screening piece. But really making sure that the employer is really looking at, the screenings, but also looking at the preventive lifestyle component. And, beyond the genetic conversation, because, there are just some genetic factors, obviously, that cannot be avoided. But really looking at those lifestyle-related behaviors that can make an impact long term. So that, and I can't say it enough, having that solid foundation of prevention really does make a huge impact for the long-term strategy. And Donna brought up a great point that we don't mention a whole lot, but not just prevention. We're not just talking about these lifestyle-related habits for, the member or the employee or the spouse. We're talking, this is a family. This is including kids, teenagers, college-age students, because this is all going to affect health plan dollars as well. So, yes, I will stand on the basis of prevention time and time again.
Katie, what are some easy things, or I guess more than easy, some important things that an employer can do to affect those lifestyle choices?
Oh my gosh, everything from, promotion of, what's our physical activity strategy? Are we promoting employees to take a 20 to 30 minute walking break during the day? Do we want to embark on, using a fitness network? Are we giving opportunities to take advantage of physical activity? Wellness challenges. The list of physical activity components goes on and on. Looking at nutritional challenges, nutritional programs. But one of the things that comes to mind is it always really helps if you've got a leader or leaders who are walking the walk. And not that they have to be pictures of perfect health, but really saying, hey guys, I got up this morning and I went for a 30-minute walk before my day started. Or, hey, it was a gorgeous day outside. 3 o'clock, I went for a walk, came back, and I was so refreshed to finish my day. Hearing those things really kind of gives the employee population almost that permission to take advantage of some of the programs and resources and behaviors to try to follow.
Hey, that's great. And in fact, if the CEO did not just run the Boston Marathon, they're probably more credible to influence people to move it. They don't seem like the exception. They're part of the standard rule.
Hands down.
Hey, Curtis, can I just add a little bit more on techniques as well? Just from the COVID standpoint, the recent studies coming out do show, Katie's point, the level of weight gain due to inactivity and poor nutrition just during the time of COVID It's averaging between 1 to 2 pounds per month that this COVID pandemic has occurred per person. So that includes, of course, not only employee, the spouse, but the children as well. And when we think about that we're going in over a year now in this state, that's an average of 12 to 20 pounds, 12 to 24 pounds that every person has gained. So just wanted to share that as well to reinforce exactly what Katie and the team are saying about the importance of the physical fitness intervention.
And I'm sure I have no idea what you're talking about, those 1 to 2 pounds a month.
Let me speak one. The only thing that I would add to the conversation is I do feel like there's a area of emotional health with chronic disease, and making sure that you have good support around the mental and the emotional health to help support anyone with chronic disease. We see that go hand in hand. And so I think that's a good add for employers to have in mind. The other thing is we hear a lot about social determinants of health and meeting those before people are ready to get well and take care of themselves. So understanding what those needs are for your population so that those can be supported and met so that they're ready to take care of themselves. I feel like those are two areas. And you hear social determinants of health. Zafira talked about it in her example where someone wasn't able to afford medication. You hear about it. Curtis also had it as he talked through his example of the person who only thought about getting his daughter off the bus. Those are things we have to be cognizant as we take care of people who have any type of chronic illness.
Amen, Renee. I mean, the health plan's core function is to promote access to healthcare. And the barriers aren't just, I don't have a health plan, I have a deductible, I don't live near a hospital. Those aren't the only barriers. A lot of barriers happen inside of people, whether it's social, cultural, or just, in my case, maybe personality type, right? Everybody's got something keeping them from doing the things, the knowing doing gap, right? Even if I know Zafira's example, clearly knew he needed medication. He had the medication before and then just stopped for whatever that barrier was for him. Renee, I think that is an awesome, especially right now, when we're dealing with what we're dealing with on such a global level. Well, this has been great information. I really appreciate it. I have a lot of good notes, so I hope the audience does too. We thank you for your time. If you have additional questions, again, send them to me anytime. I think I can speak for all the panelists. We're glad to help improve health costs and healthcare experience however we can. Our next episode will be April 22nd, and we'll be talking about population health a little more broadly, specifically an employee population, but a little more broadly, approaching the topic a little more broadly. Thanks so much. Y'all have a wonderful day, and we'll talk to you soon.
Thank you.
Thank you.
Thank you.